Case number 3 is a patient with a mass along the ulnar or medial aspect of the forearm and elbow. An ultrasound was performed which shows the brachial artery and median nerve at the level of the elbow. You can see the subchondral bone plate coming into view here with the overlying cartilage. And if you look carefully, you see the median nerve partially encased by this soft tissue mass here that extends up to the brachial artery and displaces the pronator teres in a volar direction. As we continue scrolling distally, you begin to see the normal fascicular architecture of the median nerve with persisting encasement by this soft tissue mass. The mass is uniform in echogenicity and isoechoic to muscle, although the architecture is very different than the muscle. It looks uniform and monotonous. And as you continue distally, you see that the median nerve becomes completely encased. Looking at another view here, we're now at the level of the medial humeral epicondyle, and you see the common flexor pronator origin here. You see the tendon coming off. You see the elbow joint down here, and you begin to see a soft tissue mass here. As we go slightly more distal, you again see the elbow joint here with the sublime tubercle over here, and this big soft tissue mass that's monotonous and extends to the edge of the field of view. It's deep, so you see the skin here, the fascia on top of the muscle, and the muscle is displaced out towards the side here, and we see significant internal vascularity within this mass. So by ultrasound, this is not consistent with a lipoma. It's deep, it's large, it's iso to hypoechoic. When you look at the mass here, it looks actually hypoechoic to the muscle. Lots of vascularity, so this definitely needs further workup. An MRI was performed. This is an axial proton density fat suppressed sequence, and we see the median nerve here at basically the same level of the ultrasound, the pronator being displaced, and you see this infiltrative mass that's extending along tissue planes, runs right up to the brachialis, and then looks like it actually partially surrounds it as you go proximally, and as you go distally, you see that indeed it does completely encase the median nerve, and then when you continue down distally, it becomes much larger and is infiltrating muscle here. So this is inconsistent with lipoma, also by MRI for numerous features, but the most obvious is that it does not follow macroscopic fat signal. On this pulse sequence, you see the fat suppressed and hypointense versus this, which remains hyperintense, but nothing about this says lipoma, and indeed you can see it's deep and infiltrative as well. So this was biopsied and was proven to reflect lymphoma.